Hello, I'm Dr. Helen PENSANTI, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we will be talking about a condition that affects millions worldwide. It's called peripheral neuropathy. This condition can cause tingling, numbness, burning pain, and or weakness in the hands and feet. And yet, so many people don't even realize they have it until it gets worse. But there's good news. When we understand what causes it, how to spot it early, and what treatments are available, we can help people live fuller, more active lives. Join me as we explore the science, the symptoms, and the solutions for peripheral neuropathy with Dr. Bryn Henderson, a board certified physician with a lot of experience in innovative care and regenerative medicine. Well, thank you for joining us.
Well, thank you for having me. It's a privilege.
What is peripheral neuropathy?
Peripheral neuropathy means the nerves outside of your brain and spine are damaged. These nerves carry signals for feeling, movement, and even autonomic functions like sweating and digestion. When they're injured, you may feel numbness, burning, or tingling in your feet and hands. Some people lose strength, balance, or coordination, or all three. Think of it like a faulty wiring in a house. The signals just don't travel correctly.
How common is it, and who's likely to get it?
It's more common than most people think. Around 7 or 10 people out of every 100 have some form of peripheral neuropathy. It's especially frequent in people with diabetes, about 1 in 4. It also happens after chemotherapy and those who have heavy alcohol use, infections, or autoimmune diseases. Risk goes up as we age, but it can affect younger adults too.
So, what actually happens inside the nerves that go, as you say, like a wire in your house that's gone bad?
Well, the nerves have two key parts: the inner wire, we call the axon, and the outer insulation, which is called the myelin. If the axon is damaged, the signals cannot travel well. If the myelin is stripped away or is damaged, the nerve still works, but much more slowly. In diabetics, high blood sugar harms the small blood vessels that feed the nerves. In autoimmune disorders, the body mistakenly attacks its own insulation. Either way, the nerve struggles to do its job.
So, when you talk about insulation, you're talking about the myelin sheath, not the axon.
That's true.
The axon's still working, but the myelin sheath starts fraying.
Yes, the
That-
insulator.
All
That's
right.
exactly right.
Okay. So, are people born with nerve problems?
Yes, some neuropathies are inherited, most common being Charcot-Marie-Tooth, which runs in families. Golly Moses, there's over 100 genes that play a role in that disorder. But during early development, special cells form our nerves and their insulation. That's the myelin, the insulation. If that process doesn't go smoothly, a person may be more vulnerable to nerve problems later in life. Most people develop neuropathy from lifestyle or health conditions, not genetics.
All right. So, what symptoms should one look out for?
The most common signs are numbness and tingling in the feet or hands, burning or shooting pain, extra sensitivity, even light touch can hurt, muscle weakness or foot drop, and balance problems or frequent falls. In severe cases, people can also have stomach issues, bladder problems, or sexual difficulties. The red flags are sudden weakness, new bladder or bowel issues, and unexplained weight loss or foot sores that won't heal. Those need urgent attention.
All right. So, when a person comes to your office and they say maybe 2 out of those 4 or 5 things you mentioned, how do you know it's peripheral neuropathy versus something else?
The diagnosis starts with listening to the patient, what they feel, when it started, and other health issues. We then do a full exam, blood tests, check sugar, vitamin Bs, thyroid, and infections. We use nerve studies like electromyograms, EMGs, or neuroconduction studies to see if the inner wire or the insulation is damaged. Which one? In our practice, we also use thermograms. This is safe, non-invasive, and that test shows the patterns of blood flow in the hands and feet. Because nerves and blood vessels work closely together, poor circulation often makes the neuropathy worse. Thermograms help us see the areas with reduced blood flow, track the progression, and check if treatments are improving circulation. It's like adding another lens to fully understand what happens inside.
All right, you talk about this thermogram. Not every doctor has a thermogram in their office. And I would like to add, having been all over California, working in every county, not every radiology center that you send somebody to for an x-ray has a thermogram. So how did you end up with a thermogram, doctor?
We ended up with thermograms because we wanted to know perfusion. In other words, it's one thing to know, like we have ultrasounds in our office too, the anatomy. It's a whole nother thing to know the function. We wanted to know the function. So these nerves travel in what they call a neurovascular bundle. And that means that the nerves work closely with the blood vessels because the nerves need the blood circulation to function properly. A thermogram helps us see the areas of reduced blood flow and check if treatments are improving the circulation.
I'm getting excited. I think that's wonderful that you have a thermogram in your office. That's amazing.
Well, thank you. And the first step is finding out the cause. Once we determine the cause, then we've got to fix it. Controlling the diabetes or correcting the vitamin deficiency or stopping harmful substances like alcohol. For pain, we often use nerve-specific medicines like duloxetine, pregabalin. Some patients benefit from topical patches or creams. Physical therapy helps with balance and strength, as does kinesiologists. But foot care is very important to prevent wound and infections. For tough cases, we often use advanced nerve stimulation like a trans-electrical nerve stimulator to improve nerve function.
So that's the TENS machine that people know about.
That's right.
Okay. So what lifestyle habits can a person change to make a difference? I mean, a lot of times people come in and say, oh, my hands and feet are tingling. And, most doctors just, it's not far enough in the disease process to do anything. And you kind of pat them on, it's just palliative medicine, really.
True. What we really focus on are the lifestyle changes that they can change. Regular walking, swimming, or cycling helps blood flows for sure and gets healthier nerves. Balance exercises reduces falls. Eating smart is also a pretty good idea. The colorful diet with vegetables, grains, nuts, fish, and healthy oils, avoiding too much sugar, which worsens their diabetes. And we ask them to protect their feet, inspect them daily, moisturize them, and wear proper shoes. Avoid smoking, which cuts off or down the circulation. Good sleep and stress management also lower pain sensitivity.
All right, so this is a question that's coming out of left field, but do people who get fungus on their toenails, is that made worse because their nerves, they don't have the blood flow going to their nerves because of peripheral neuropathy?
That's a good question because everything heals in proportion to its circulation. So if they've got a fungus or any infection someplace and they're not getting adequate circulation, absolutely it gets worse.
All right. Well, what about traditional Chinese medicine? What do they use?
Well, I've been doing this for a few thousand years, and they supplement our knowledge with creating more understanding of the balances of the body. Acupuncture and some herbal treatments reduce pain and improve circulation. The studies show that acupuncture can calm inflammation and help nerves repair. Herbs also support blood flow and enhance nerve healing. These treatments should always be done safely and best alongside, not instead of, standard medical care.
All right, talk about your regenerative options that you make available in your office.
Well, we're very excited about the new therapies. Platelet-rich plasma, PRP, uses your own platelets injected near the nerves to reduce pain and encourage repair. Exosomes are tiny messengers from the stem cell wall that reduce inflammation and support healing. The regenerative cells, especially with those from early studies, they suggest they can calm inflammation, release growth factors, and promote nerve regrowth. Many patients are finding hope in those options.
All right, how should patients follow up?
After treatment starts, we usually see patients in 4 or fewer weeks to check progress. Then every month to track symptoms, adjust the medications, and reinforce foot care. At least once a year, we do a full screen for complications like ulcers, falls, and muscle loss. It's really important to have a team effort. We don't ignore the symptoms. Early care makes a big difference. We ask them not to smoke or drink heavily, and both harm nerves and both decrease blood flow. So you avoid the unsafe facets, whether they're shoes or their body positions. Sometimes they go unnoticed until we bring it to their attention. You never stop the medication suddenly without guidance. With a clear plan and steady follow-up, most people can reduce pain and stay active.
All right, what's your mnemonic for peripheral neuropathy?
It's nerve pain.
N stands for?
Nutrition and supplements. Eat a colorful plate. Ask about the B vitamins, vitamin D and omega-3s.
E?
Exercise. Gentle aerobic and balanced work, walking, cycling, swimming, tai chi, and yoga.
R?
Regenerative options. Ask your doctor about PRP, exosomes, and peptides.
V?
Vitals and vascular health. Track the sugar and blood pressure, as well as the cholesterol.
E?
Education and foot care. Daily foot checks, moisturizers, safe shoes, know when to call.
P?
Pain plan. Use nerve pain meds as prescribed. Add non-drug tools, relaxation, as well as TENS units, transelectrical nerve stimulators, and acupuncture.
A?
Avoid nerve toxins. No smoking, limit the booze or alcohol, and review meds that may hurt nerves.
I?
Investigate if not improving. Your progress should be monitored, and we can do that with objective testing.
N?
Neurology team includes, besides neurologists, a physician team to see a specialist for fast changes, weakness, or unclear causes.
Well, today we've learned that peripheral neuropathy is not just about tingling toes or numb fingers. It's about protecting our nerves, improving circulation, and staying active. With modern tests like thermogram imaging, lifestyle adjustments, medicines, and even regenerative therapies, there are solutions better than ever in medicine now. So remember, listen to your body, care for your nerves, and act early. Because when it comes to nerve health, the sooner you act, the stronger you step into tomorrow. So thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen PENSANTI. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.